This morning, we welcome Shawnee County Health Officer Dr. Gianfranco Pezzino here. Thank you so much for being with us, Dr. Pezzino. We appreciate it.
My pleasure.
Well, a big question this morning. Obviously, the governor's statewide stay-at-home order does end on May 3rd. Now, on a county level, for Shawnee County, will that stay-at-home order continue to end on May 3rd, or is that going to change based on the county level?
Well, first of all, assuming that that order expires on May 3rd, it does expire, but it needs to be lifted, and it will probably be replaced by something else, by the governor. So the first thing we need to do is to wait and see what the governor decides to do. And there is a possibility that the governor will require some new restrictions on, throughout the state, for all the counties, which will probably not take the form of a stay-at-home order. So the first thing we are doing is really watching very carefully what the governor decides to do. At that point, we will decide if there is a need for additional restrictions here in Shawnee County. We have been working very diligently in the last several days to prepare plans and to have different phases in which we can send people back to as much of a normal life as possible under the circumstances.
So go into more details, Dr. Pezzino, on those phases, specifically, of course, phase 1, should that start here soon. What will that look like, and who will be following those guidelines specifically for restrictions?
So unfortunately, I do not have all the details that I can share right now because they're still being worked out. And as I said, they will depend in large part on what happens with the statewide new executive orders that the governor may decide to impose on the state. Generally speaking, you can expect a progressively relaxing movement towards fewer and fewer restrictions over time. The key element here is over time. It's not going to take just a few days. Each phase will last at least 14 days. The first phase, you can expect that all business should be able to reopen, with a few exceptions. Some business that we consider at high risk of transmission may still remain closed for a couple of additional weeks. And many businesses will still have some restrictions on their own operations. But the situation that we have today, where only essential businesses can operate, that should go. That will be the first thing we will lift, and people will be able to leave their homes. We know that that's really the highest burden we are asking our community to take, and that's the first burden we are going to lift.
And, you know, one other big question is, how are you balancing the society's kind of controversy over the economic burden on this? And a lot of people still not able to get unemployment benefits they were promised. So a lot are thinking they need to reopen their business to make a living. Are you concerned that there is overreaction on this?
I am concerned about all the sides of this big dilemma, and I'm really very concerned about the economic impact of our decisions. My job is primarily to look at the public health aspects of the situation, but it doesn't mean that I'm insensitive or impermeable to considerations that happen beyond the public health arena. What I can say is that even though I sympathize and I understand those arguments that we need to reopen, we need to reopen, we need to reopen. Yes, I hear that. We need to reopen with some level of safety, though. We can't just reopen and go back to where we were 4 or 5 weeks ago, or perhaps even worse, overwhelming our healthcare system, which in Shawnee County never happened, in part because we imposed those measures, restrictive measures, very early. There can't be a healthy economy without healthy communities and healthy people. If people are afraid to leave their homes because they're afraid of the virus, if we see a number of cases skyrocketing, if we see a number of admissions in the hospital going up to a level that's really disconcerting, then economic recovery will not take place. So we try to balance both aspects. We get a lot of input and advice from our business community. At the end of the day, it's going to be really finding the best balance that can accomplish a little bit of both.
All right, well, thank you so much, Dr. Pezzino, for being with us this morning. We certainly appreciate it. And Dr. Pezzino will be sticking around for our Fox 43 AM live show. That starts at 7 o'clock. So make sure you do switch over and hear further more on this conversation with our Shawnee County Health Officer.